vapors. A carbide ball, the moment you put it into the filling, it will pop up within less than like 10 seconds. It just pops up. Because the amalgam is not glued onto your teeth. There's like a cavity which is made in the shape of an inverted cone. And the filling is just dumped inside. Just like you fill a pothole. They're just filling a pothole in your tooth. And when you put the ball inside, it drips the filling out, it just pops out. There's hardly any vapor. As I said, all this thing about a fad of a Bar-Lossy lens is just a fad. There's no truth to it at all.
Makes sense.
Yeah, sure.
Just another question. For Tariq. I have a patient who is very young, so actually, but she was looked at me like a huge abdomen. And she said she was very stressed. How can you relate that to whether she's got leaky gut or irritable bowel syndrome?
Yeah, so if she is bloated and has frequent burping, that's definitely a marker of high SNS, as I have explained, and she could be having leaky gut because of that. So you just have to use lycopodium on her. She has bloating and burping, right, together?
Yes.
Yeah, you just...
huge abdomen.
Yeah.
Because there's nothing there.
So you just give her lycopodium and you deworm her, and you see the effects really fast in her. Who was the doctor in our group who spoke about that case? What is the doctor's name, Amanda?
Dr. Sharifa Sharif. She's not here.
Oh, she's not here.
Yes.
So she had a case who went to so many doctors for more than, I think, 5-6 years, and the patient had only a symptom of bloating and burping and big abdomen. So Dr. Sharifa has just joined a course, so she learned about lycopodium, gave it to the patient for a week. After a week, the patient came back and said, "What magic did you do? I went to so many doctors, so many hospitals for over 5 years, and my bloating and burping is gone."
Thank you very much. The other one is that is headache
Yeah.
and burping a symptom of leaky gut?
Yeah, so you could have headache with burping and acid reflux. Okay. Are you talking about that? The patient has a headache if they don't eat on time?
Yes. Yes, when they don't eat on time,
Yes.
they got headache. Actually, I'm the patient.
Oh, you're the patient. So that requires another specific homeopathic remedy. Dr. Chen, what is the name of the homeopathic? Do you remember? Sancan, exactly. So it's called as Sancan. Okay? Sanguinaria candescens. Very peculiar little med it is. So if you get headaches, okay, if you don't eat on time, just take the Sancan and it will treat you. Just use 30C.
So what's the pathophysiology behind it actually?
So we can send you the notes on Sancan. You'll have to read it of how it basically ameliorates histamine dysfunction. It is the same med that we use to treat oral cancer, by the way, and it also treats this particular symptom. So the same way, I mean, there are two different effects that it has, and one is on this particular thing. We'll just ask Amanda to send that snapshot of its action.
Okay, thanks very much.
But it will cure you. It's sang. It's just like singing. S-A-N-G and can. Can you sing? Or can you sang? I don't know. Sang can. This is 30C. That's just the potency.
Dr. How do you treat SIBO using homeopathic alone?
Okay, so I can tell you that. So, firstly, what bacteria do you think are overgrowing in SIBO? Anyone? What species of bacteria are overgrowing? E. coli, Klebsiella? What do you think is regrowing in the gut? Or is like growing in excess? Come on guys, what's growing in the gut to cause SIBO? Okay, which part of the colon is affected? Small intestine, large intestine? Small intestine. Okay, so your small intestine bacteria. Normally, what kills off the bacteria in the small intestine? Huh? Acid, right? So your stomach acid is killing them off, isn't it? So haven't you noticed SIBO is very common in patients who are on PPIs? Yes, exactly. So first thing is we need to stop them from going on their PPIs. Okay? So we have a list, we have very very large possible causes of chronic acidity. But the simplest remedy that we give is called as bismuth. If the patient also has acidity in the night, a lot of patients will have acid reflux in the night. For those, we give Robinia. So I'll tell you a case of this. So we have a doctor in a group, his wife has got heart failure and her NT-proBNP was over 1500 and they had asked her to go for a heart transplant. So she had one particular symptom, consistent acid reflux in the night. So I said, hey, what else is going on in her? So she had neck pain, constant neck pains. Now if you have a fracture in the level of your T3 or you have compression in the area of your T3, your sympathetic reflex or the sympathetic nervous system which goes to your gut doesn't function very well. And you get severe acid reflux in the night. That's one of the symptoms of damage to your T3 vertebra. So because of the neck pain, basically she was having compression of the T3. And this Robinia fixes that nervous system that's going from your spine into your gut. And when we gave her this Robinia, not only did the acid reflux completely go off, but within about 1.5 weeks, her NT-proBNP is decreased by nearly 30%. And every week on week it's improving. So most of these patients of acid reflux, especially in the night, may have no problem in the gut. They have a problem in the spine that's causing them the issues. Okay? So bismuth and Robinia are the most frequently used medications for acid reflux. Okay. Now again, let's get back to the gut. If you give probiotics to a patient with SIBO, like you give lactobacillus, what happens to them? You can just use a microphone. Where's the microphone here? Took it away.
More gas.
More gas.
For diarrhea?
They could have diarrhea, they could have gas. Yeah? They are solving the gas crisis that is currently hitting Europe. So they produce a lot of gas because you already have so much of lactobacilli growing, and you're putting even more of it inside. You already have so much of these bacteria growing. So you basically just need to improve the patient's digestion for SIBO. So first fix the acid, give them the bismuth, give them the Robinia, help them to make more acid, stop their PPIs. And then SIBO is very easy. We give a medication called as asafoetida. You guys have heard of it? It's an Indian herb. This year we can have it available as a homeopathic, like in a 30C potency. And we give something known as carbo-veg. So carbo-veg is basically activated charcoal, which is in a homeopathic form. If you see, one of the treatments for SIBO is, don't you guys give activated charcoal to your patients? Yeah? So in the homeopathic form, it works far better than just giving the activated charcoal. And you give asafoetida to help them digest the food. So you're just treating the patient's acidity and you're giving them asafoetida carbo-veg. If they have high SNS with bloating and burping, you give them lycopodium. And one other symptom of SIBO patient, they are worse on spicy food. They can't tolerate spice. So for those patients, you give Thuja. Thuja. So Thuja improves the secretory IgA in the gut and basically just keeps throwing all those bacteria out of your gut. Okay, this is the most simplistic treatment for SIBO, right? I hope you've understood how simple the concept is, right? Does anyone find this complicated? No, it's really very simple. You're just improving acid secretion and then you're giving them things to improve their digestion. So asafoetida is quite a remarkable little herb, right? It improves all your pancreatic enzymes, your lipase, your amylase, your peptidases, all of them improve with it. It also helps to increase the gut motility and thereby cure SIBO. Okay. Any other questions? Sure.
Doctor, I have a relative. She's about 35 years old, a tailor. Okay. I have a relative. She's a 35 years old lady, a tailor. She complains of extensive acid reflux.
Okay.
And past 2-3 months, she said whenever she takes solid food, she must drink water so that the food can come down If not, she will feeling the choking feeling.
So this may be a symptom of LPR. She has continuous acid reflux, she can feel the burn or she doesn't feel the burn.
She feels the burn.
Okay, so the choking may be because of the acid reflux actually causing scarring inside, there may be some scarring. And also she could be having LPR as well, which is non-acid reflux. She has SIBO as well?
She has some bronchitis.
Especially after carbohydrates, it becomes worse for her?
I'm not sure about that, but her main complaint is whenever she takes solid food, although little bit, she needs some water to bring it down. If not, it's stuck in the throat.
Yeah, so there's definitely some sort of decreased movement of the throat, and I would really just advise you to treat the acid reflux. You could possibly just start with bismuth med. Does she also have night reflux?
Yes.
Yeah, so just use the bismuth and the rubinia and you'll find that she improves quite a bit. Okay. Also ask for a spicy food. If she is worse on spicy food, remember to add toja. Okay. If she's having a lot of gas passing through basically the anal area, you need to use carbo-veg. If she's just burping up the gas, use lycopodium. Or is passing the other way around, use asafoetida and carbo-veg. Okay.
Thank you.
Sure. Any other questions? Yeah.
Just to conclude the whole thing, the patient has got bloatedness and the burping. You said lycopodium, right?
Yes. Lycopodium, they're just burping it out.
Yeah, so how do we look to this? She doesn't need all this, right? The patient with the burping, she doesn't need.
No, she won't need the rest of it. She just has bloating and burping, and she's basically has stress responses. So she'll have sweaty palms. She will have bloating and burping all the time. We just use lycopodium. The sweaty palms will go, and the bloating and burping will go off.
Okay. She doesn't need to deworm, right?
She will not need to deworm. If you need to deworm after that, do it. There's no harm in doing the deworming because parasites, I'm sure, are common in your population as well. Dr. Chen, who's behind you, will tell you so many cases of her dementia patients improving after doing deworming. So Dr. Chen is a geriatric specialist and has done so many patients of dementia by just treating them for fungal and for parasites. After treating them for just parasites and fungal, within a few days the patient's entire behavior changes. Their dementia just starts to dissipate off. So if you think that yeast doesn't matter, ask Dr. Chen. That case that Dr. Chen had where after we gave the praziquantel, the patient started passing worms in the urine. And as she started to urinate the worms out, the entire mental issues of dementia and whatnot the patient had, they all started improving. Any other questions? Yeah, should we call it a day? Yeah, okay, good. Thanks for that.